Doctora Marín.
In general speaking, if you have a rejection, do you advise a second procedure? And which is the limit to avoid the abuse to do this kind of procedure? This is the first one. And in children with chronic myelogenous leukemia, what about the use for a long period of time with inhibitors of the target treatment? It means I am talking about the expensive treatment for a long period of times with this kind of patients.
Mm-hmm.
So for the first question, in the myeloablative setting, typically if patients have graft rejection or graft failure, because we don't know, it could be rejection, or it could just be that the cord, when it's thawed out, is not viable and it doesn't engraft. But regardless, if the patient doesn't engraft, then they have no hematopoiesis and they need to have a second transplant or they'll die. So we do give second transplants. Now the outcomes of second transplants are pretty poor overall, so it could be questioned in terms of a cost perspective, but we do that. The second question, I'm not sure if I understand what you're asking. So,
yes.
Chronic myelocytic leukemia. If you are, doctor.
Yes, about the treatment for a long period of times for children with this disease.
You advise
instead to try these patients with transplant. I am talking about the cost
sure.
of the procedure, so to continue the treatment for 20 years with dasatinib, any kind of tinibs.
Right, I understand now. This is a great question, and it's one of the most controversial questions in pediatric transplant today. Should a patient with CML, chronic myelogenous leukemia, should they go to transplant, or should they be on imatinib or dasatinib or nilotinib, and the costs associated with all of this. And so there are some issues for children being on tyrosine kinase inhibitors. They tend not to grow as well, and they have other problems. The concern of tolerance and issues. The concern of long-term growth is still, long-term resistance is still a concern in a 5-year-old or a 10-year-old. That's probably not such a big worry in a 60-year-old, let's say. But with that said, for the most part, most of our patients with CML, we do not transplant. The reasons to transplant them are if they don't meet the major milestones of hematologic, molecular, and cytogenetic response that have been outlined by Brian Drucker in the New England Journal paper. That's one reason why we transplant them. But even those patients, we typically will let them go to dasatinib. And then the other reason to transplant them, in our view, is if they are intolerant of the medicines or non-compliant, which is another reason that we've used to transplant patients. But from a cost perspective, the cost of these medicines are, as everybody in the room knows, is incredibly expensive. And the cost of transplant is also very expensive. But I think over the lifespan of a patient, it's probably more economical to do transplant. But there's a personal cost.
Thank you.
¿Alguna pregunta? ¿Alguna pregunta más, doctor Martínez Murillo? ¿No? It's a question that my group asking you all the morning is what prophylaxis are you using in hematopoietic cell transplantation patients in your group, Dr. Berneris?
So, infection prophylaxis?
Sí, infection prophylaxis.
So, everybody upon neutrophil recovery goes on Bactrim or Septra. prior to transplant, frequently patients who are already on voriconazole or caspofungin, especially the myeloid leukemia patients or the MDS patients, and that's continued through transplant. As we talked about earlier, one of the things that we've noticed a lot is with voriconazole, after transplant, absorption is not so good. And this is a major concern because you're giving this patient this medicine, you think it's working, but in fact, they're not absorbing it. So voriconazole levels are important to check, and if you don't have access to voriconazole levels, perhaps either IV voriconazole or caspofungin, maybe, or mycofungin may be a better drug to use. And then lastly, pretty much all of our patients for the first 100 days are on afloxacin, ciprofloxacin, or levofloxacin.
Okay. Okay.
Oh, and then anybody who is either CMV positive or receive a transplant for someone who's CMV positive are on high-dose acyclovir.
Okay. Okay. Thanks. Another question? Bueno, muchísimas gracias.
Muchas gracias a todos. Les vamos a dar un reconocimiento, por favor, por parte de la Agrupación Mexicana para el Estudio de la Hematología, a cada uno de nuestros ponentes, por haber venido y por la excelente presentación. Y bueno, pues agradecer la presencia de ustedes en esta sesión mensual académica. Quiero, antes de finalizar, dar las gracias a la compañía Pierre Fabre por todo el apoyo que nos ha brindado para que estemos el día de hoy aquí presentes, por supuesto con el apoyo para haber traído al Dr. Michael Berniani. Thank you for coming and being here. Y por la excelente sesión que nos presentó el día de hoy. Nada más recordarles que nuestra próxima sesión es en el mes de octubre y va a ser sobre el tema de anemia plástica, y viene el doctor Neil Young, ¿no?, que es toda una autoridad en anemia plástica. Entonces están cordialmente invitados, y enfatizar que nuestra página de internet vamos a estar poniendo los videos. De hecho, ustedes pueden consultar gratuitamente todos los videos de todas las sesiones mensuales en las cuales se presentan y se proyectan con cada mes. Y también hacer la invitación para que se hagan aquellos que son médicos hematólogos, químicos, residentes ligados al área de la hematología, que se pueden hacer socios de la Agrupación Mexicana para el Estudio de la Hematología y tener todos los beneficios. Hay una serie de beneficios, entre ellos el poder entrar gratuitamente a nuestra página de internet, que tiene un acceso a Up to Date, en el cual pues podemos tener acceso a información bibliográfica actualizada y poder tener acceso a múltiples funciones, tener seguro de vida, seguro de gastos funerarios. Entonces, una serie de beneficios que trae consigo el ser socios, y el cual reitero la invitación para que se hagan socios de nuestra sociedad, y nuevamente empezar a hacer ya el comercial, que el próximo año nuestro congreso anual de hematología en el 2013 se llevará a cabo del 17 de abril del 2013 en la ciudad de Mazatlán, Sinaloa. Así que están cordialmente invitados para que lo agenden y lo vayan contemplando en este paradisíaco lugar. Así que no me queda más que finalmente agradecerles su presencia el día de hoy, y nos estaremos viendo de aquí a un mes. Muchas gracias y buenas noches, tanto los que están aquí como los que nos están siguiendo en línea. Muchas gracias. Buenas noches.